Hello, everyone. My name is Matthew Webb, and I'm a student physical therapist with a CSCS and a BS in nutrition science. Today, I'm going to be talking about magnesium. A fun fact about magnesium is that it is involved as an enzymatic cofactor in over 300 known enzymatic processes in the body. This here is going to be the 13th in a series of educational videos intended for healthcare professionals to help us in direct access healthcare fields become more adept at identifying nutritional deficiencies so that we can get patients presenting with one of these diseases the help that they need. So, without any further ado, allow me to present to you magnesium. Firstly, we're going to go into the very basics behind deficiency of magnesium, then we'll break down the science behind why patients are presenting the way that they do. Then I'll give you some takeaways to help you identify this disease. When a patient has magnesium deficiency, they can develop tachycardia as well as numbness and tingling in the hands and feet. And we'll go further into the science behind these presentations and the risk factors later in this presentation. But I just wanted to provide you an idea of what we're going to be getting into in this lecture right here. Here is the impacts of magnesium deficiency on the heart. So, magnesium is an enzymatic cofactor for sodium potassium ATPase pump function. Magnesium deficiency impairs this function. Ultimately, it causes a decrease in intracellular potassium and an increase in intracellular sodium. Cardiomyocyte action potentials occur at approximately negative 70 millivolts, and their resting electronegativity is usually around negative 90 millivolts. The increased intracellular sodium at rest in magnesium deficiency decreases the cell electronegativity, bringing it closer to that action potential threshold. This makes the cell more excitable and can potentially cause tachycardia. Magnesium as an electrolyte impacts cardiomyocytes, but it impacts neurons as well. In neurons, magnesium postsynaptically blockades calcium from entering the N-methyl deaspartate or NMDA receptor, which is a ligand-gated ion channel and inotropic glutamate receptor. If this blockade is not regulated, such as in the case of magnesium deficiency, excess calcium enters the postsynaptic neuron, causing calcium overflow into that neuron, which ultimately causes unregulated depolarization and induces excitotoxicity. Excitotoxicity is associated with nerve cell damage and death. Ultimately, if left untreated, this will eventually lead to neuropathy. Here's some risk factors you can look out for. Alcoholism impairs magnesium absorption due to intestinal damage. Kidney disease can increase magnesium excretion which increases risk. Hyperthyroidism can increase magnesium excretion by the kidneys. Gastric bypass surgery can lead to malabsorption, and decreased food consumption after surgery is also a potential reason for magnesium deficiency. Celiac disease is another risk factor because it can cause intestinal damage and decrease absorption. As far as drugs go, proton pump inhibitors can increase magnesium excretion, and thiazide and loop diuretics increase magnesium excretion. Some subjective questions to ask would be about past medical history, and you should make note of kidney disease, hyperthyroidism, gastric bypass surgery, and celiac disease. Ask them what medications they're taking. Make note of corticosteroids, PPIs, and loop diuretics. Ask about any alcohol consumption, and of course, find out what that looks like. Diseases that individuals can be at greater risk for with magnesium deficiency are arrhythmias, heart disease, and osteoporosis. For clinical exam, neuro findings will include numbness and tingling around the hands and feet. Cardiovascular findings will include tachycardia. The main takeaways as far as the what, how, and why behind the presentation is that magnesium deficiency can lead to tachycardia. This is because magnesium is an enzymatic cofactor for sodium potassium ATPase pump function. Magnesium deficiency impairs this function. Ultimately, it causes a decrease in intracellular potassium and an increase in intracellular sodium. Cardiomyocyte action potential occurs at approximately negative 70 millivolts, and their resting electronegativity is usually around negative 90 millivolts. The increased intracellular sodium at rest in magnesium deficiency decreases the cell electronegativity, bringing it closer to the action potential threshold. This makes the cell more excitable and can potentially cause tachycardia. Magnesium deficiency can also cause neurodegeneration because magnesium deficiency uh, causes the N-methyl deaspartate or NMDA receptor not to function the way it's supposed to. Postsynaptically, magnesium blockades calcium from entering the N-methyl deaspartate NMDA receptor. If this blockade is not regulated, such as is the case for magnesium deficiency, excess calcium enters that postsynaptic neuron, causing calcium to overflow into the cell, causing unregulated depolarization and inducing excitotoxicity. And excitotoxicity is associated with nerve cell damage and death. Ultimately, if left untreated, this will eventually lead to neuropathy. And here are my resources. Thanks for watching. Note that I'm making these presentations during a pretty busy semester, so I'm liable to make some mistakes. If so, let me know in the comments, and if your questions check out, they'll either add it to the video description or I'll pin your comment. If you learned something from this video and you want to learn more, continue on to the potassium video.